Hello, this is going to be setup and use of a TENS unit. This one will be a Precision TENS 3900. Of course, get out your case. You should take a moment to brief yourself on the manual. It'll tell you simply a quick explanation of pain, cautions, construction, technical specifications, the accessories that you need, treatment modes, and again, who the unit has been professionally distributed by. We're going to need to have our electrodes ready. We'll get out our initial TENS unit. We're going to start with removing the transported protective film. Put our thumb on the texture point, give it a slide down. We're going to go ahead and bump off the battery plate cover. Get the battery ready. It's going to go in the battery compartment. Let's take a moment to make sure we get the positive to the positive terminal. Set the battery in position. Drop it down. If you'd like, you can test the unit. Indicator light comes on. We're ready to go. Put your battery cover control protector back on. Size it up. Give it a little click. You can see it's ready to operate in range. So with that, we're ready to set up electrodes and the lead wires. Picturing initially that we're going to just use one side of the unit, and here would be the injury side. The idea here is to work on the gate theory where we pass the current in through one electrode through the injury site back out through the other electrode. These electrodes are also referred to as sticky patches, but commonly and most professionally referred to as electrodes, to be used on clean, dry skin. We'll get out a lead wire. Some folks might find it easier to engage the lead wires while they're on the carrying card. Everything all set. These channels are referred to as channel A or channel B, sometimes channel 1, sometimes channel 2, right or left. Just know that each channel controls a pair of electrodes. Red or black, again, is your preference as to which side. Sometimes it's interesting to invert the wires, meaning send the signal back through the other direction. It's okay to push the wire together, then replace the electrode. At this point here, we're ready to set your controls and turn on the unit. As you slide your plate open, you'll find the pulse rate, you'll find the pulse width, your selection of modality, and then your timer setter. Each one of these are a way of basically changing the way this signal fills as it's coming at you. Your doctor can teach you specific settings for your specific affliction. The unit's set at mid-range settings, M for modulation. Click the battery cover closed so we don't have to worry about those controls being changed. You're ready to turn on the unit at this point at the intensity knobs up top. When turning on the unit, you'll hear a click. You'll see the indicator light come on. Start moving the power up slowly. You should start feeling the signal at somewhere between 20 and 30 milliamps, or measured as a 2 or a 3. Now I'm clearly feeling stimulation. Unit's working fine. Some folks need to think you need to turn it up really high so you're getting contractions. Not necessary. You need to be feeling the signal, not seeing it. Your doctor can teach you more. With that, this particular unit is now set to run on a 30-minute treatment time. When I'm done with the unit, when the treatment time of 30 minutes has gone by, it'll turn off. I'll need to remember to turn the unit down, click to off, and store it for the next treatment.